Question 1. Which approach would be most effective for a registered nurse aiming to demonstrate advanced expertise and pursue career growth in pediatric oncology nursing? Option A. Completing a master's degree in nursing with a general focus on advanced practice. Option B. Pursuing a generalist certification in medical surgical nursing. Option C. Obtaining a certification specifically in pediatric oncology nursing from a recognized professional nursing organization. Option D. Relying on years of informal on-the-job experience without formal validation. Correct answer is C. Obtaining a certification specifically in pediatric oncology nursing from a recognized professional nursing organization. Explanation. The scenario presents a challenge for a registered nurse seeking to advance their career and demonstrate expertise in a specialized area of practice, such as pediatric oncology. The core of the challenge lies in identifying the most effective and recognized pathway to validate this specialized knowledge and skill set within the nursing profession, particularly as it relates to professional development and potential career advancement opportunities. Careful judgment is required to distinguish between informal learning, broad certifications, and specialized credentials that directly align with advanced practice in a specific field. The correct approach represents best professional practice because it directly addresses the need for specialized knowledge validation. Pursuing a certification specifically in pediatric oncology nursing, offered by a recognized professional nursing organization, demonstrates a commitment to advanced competency in that particular specialty. This aligns with the National League for Nursing's (NLN) emphasis on professional development and the acquisition of specialized knowledge to improve patient care outcomes. Such certifications are often recognized by employers as indicators of expertise, potentially leading to career advancement and greater responsibilities. Ethically, it supports the principle of beneficence by ensuring the nurse possesses the highest level of competence to care for a vulnerable patient population. An incorrect approach would be to rely solely on general nursing certifications. While valuable for foundational knowledge, a general certification does not specifically validate expertise in a niche area like pediatric oncology. This fails to meet the professional standard of demonstrating specialized competence required for advanced practice in that field. Another incorrect approach would be to consider a master's degree in nursing without a specific focus on pediatric oncology as the primary method of specialization. While a master's degree provides advanced theoretical knowledge, it may not offer the direct, hands-on, and evidence-based practice validation that specialty certification provides for a specific patient population and disease process. This approach lacks the targeted validation of skills and knowledge crucial for specialized pediatric oncology nursing. The professional reasoning process for similar situations involves a self-assessment of career goals and the specific knowledge and skills required for those goals. It then necessitates researching recognized professional organizations and their credentialing processes to identify relevant specialty certifications, evaluating the rigor of the certification process, its alignment with current evidence-based practice, and its recognition within the profession and by potential employers are critical steps. This systematic approach ensures that professional development efforts are targeted, effective, and lead to demonstrable expertise that benefits both the nurse and the patients they serve. Question 2. The review process indicates that a pediatric nurse is preparing to conduct a developmental assessment on a 3-year-old child presenting for a routine well-child visit. The nurse has access to various assessment tools and has reviewed the child's medical history. Which approach best optimizes the developmental assessment process? Option A. Focusing exclusively on assessing the child's fine motor skill through a series of structured tasks, assuming other developmental domains will be adequately covered by the physician's examination. Option B. Administering a comprehensive checklist of developmental milestones and marking off each item the child can reportedly perform without further direct observation or caregiver discussion. Option C. Prioritizing the completion of the assessment as quickly as possible to adhere to clinic schedules, potentially by asking the caregiver to answer all questions without observing the child's actual abilities. Option D. Utilizing a combination of age-appropriate standardized screening tools, direct observation of the child's play and interaction, and open-ended questioning of the caregiver regarding the child's daily functioning and milestones. The correct answer is D. Utilizing a combination of age-appropriate standardized screening tools, direct observation of the child's play and interaction, and open-ended questioning of the caregiver regarding the child's daily functioning and milestones. Explanation. The review process indicates a need to optimize the approach to developmental assessment, which is a cornerstone of pediatric nursing practice and directly impacts patient care outcomes. This scenario is professionally challenging because accurately assessing a child's developmental stage requires a nuanced understanding of typical milestones, individual variations, and the ability to elicit reliable information from both the child and their caregivers. The goal is to identify potential delays or deviations early to facilitate timely intervention, which is ethically mandated and aligns with professional nursing standards. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that integrates objective observations with subjective reports, while also considering the child's emotional state and environmental factors. This holistic view ensures that the assessment is not only accurate but also sensitive to the child's needs, fostering trust and cooperation. This aligns with the National League for Nursing's emphasis on evidence-based practice and patient-centered care, ensuring that interventions are tailored to the individual child's developmental trajectory. An incorrect approach that relies solely on standardized checklists without considering the child's presentation or caregiver input fails to capture the full picture of development. This can lead to misinterpretations, misdiagnoses, or unnecessary anxiety for the family. Ethically, this approach neglects the professional responsibility to provide thorough and individualized care. Another incorrect approach that focuses only on gross motor skills overlooks crucial areas like fine motor, language, social-emotional, and cognitive development, leading to an incomplete and potentially misleading assessment. This violates the principle of beneficence by not fully addressing the child's well-being. A third incorrect approach that dismisses caregiver concerns without thorough investigation is professionally unacceptable. Caregivers are invaluable sources of information about a child's daily functioning and can provide insights that might not be apparent during a brief clinical encounter. Ignoring their input can lead to a breakdown in the nurse-patient relationship and a failure to identify significant developmental issues. Professional reasoning in developmental assessment involves a systematic process. First, gathering baseline information from the caregiver and reviewing the child's history. Second, selecting appropriate assessment tools and techniques based on the child's age and presenting concerns. Third, conducting the assessment in a child-friendly environment, observing the child's interactions and responses. Fourth, actively listening to and validating caregiver concerns. And finally, synthesizing all gathered information to form a comprehensive developmental profile and plan for follow-up or intervention. Question 3. The analysis reveals that a patient, recently prescribed a new antihypertensive medication, reports feeling a bit dizzy and tired after the first dose. The nurse has also noted a slight decrease in the patient's blood pressure reading compared to their baseline. Considering the National League for Nursing pre-admission examinations focus on evaluation, which of the following represents the most appropriate nursing action? Option A. Reassure the patient that these symptoms are common with new blood pressure medications and advise them to rest. Option B. Focus solely on the fact that the blood pressure has decreased, interpreting this as a positive therapeutic response and disregarding the reported symptoms. Option C. Immediately contact the physician to report the dizziness and fatigue, requesting an adjustment to the medication dosage. Option D. Document the patient's reported symptoms and the objective blood pressure reading, and continue to monitor the patient closely for further changes, educating them on potential side effects and when to seek further medical attention. The correct answer is D. Document the patient's reported symptoms and the objective blood pressure reading, and continue to monitor the patient closely for further changes, educating them on potential side effects and when to seek further medical attention. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to evaluate a patient's response to a new medication, balancing the need for therapeutic effect with the potential for adverse reactions. The nurse must critically assess subjective and objective data, considering the patient's individual presentation and the established parameters for effective treatment and safety. This demands a nuanced understanding of pharmacology and patient assessment, moving beyond simple observation to informed judgment. Correct approach analysis. The correct approach involves a comprehensive evaluation of both the patient's reported symptoms and objective clinical findings. This aligns with the National League for Nursing (NLN) core competencies, particularly in patient-centered care and evidence-based practice. Best professional practice dictates that a nurse must gather all relevant data, compare it against expected outcomes and potential side effects, and then formulate a clinical judgment. This systematic process ensures patient safety and promotes optimal therapeutic outcomes, adhering to the ethical principles of beneficence and non-maleficence. The NLN emphasizes the importance of critical thinking and clinical reasoning in nursing practice, which this approach embodies. Incorrect approaches analysis. One incorrect approach might involve solely relying on the patient's subjective report without seeking objective verification. This fails to meet the standard of comprehensive nursing assessment, as subjective data can be influenced by various factors and may not always reflect the full clinical picture. Ethically, this could lead to a failure to identify serious adverse events, violating the principle of non-maleficence. Another incorrect approach could be to dismiss the patient's reported symptoms as insignificant without a thorough evaluation, perhaps due to a preconceived notion or time constraints. This demonstrates a lack of critical thinking and can result in delayed or misdiagnosis of adverse drug reaction, compromising patient safety and violating the nurse's duty of care. A third incorrect approach might be to focus only on the intended therapeutic effect of the medication, neglecting to actively monitor for and assess potential side effects. This narrow focus is contrary to the holistic approach to patient care advocated by the NLN and can lead to adverse events going unnoticed and unaddressed, posing a significant risk to the patient. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with data gathering, subjective and objective, followed by analysis and interpretation of that data in the context of the patient's condition and the medication's known effects. This leads to the formulation of nursing diagnoses and the development of an appropriate plan of care, which includes ongoing evaluation and modification as needed. The NLN's emphasis on critical thinking and clinical judgment guides this process, ensuring that decisions are evidence-based, patient-centered, and ethically sound. Question 4. Process analysis reveals a patient exhibiting agitated behavior that poses a risk of falls. The nursing staff is considering the use of physical restraints to ensure the patient's safety. Which of the following actions best reflects current best practice and regulatory guidelines for the use of restraints? Option A. Use restraints as a temporary measure until the patient's family arrives to provide supervision. Option B. Obtain a physician's order for restraints after a thorough patient assessment and exploration of less restrictive interventions. Option C. Restrain the patient only if the family explicitly requests it for their own peace of mind. Option D. Apply restraints immediately based on the observed agitation to prevent any potential fall. The correct answer is B. Obtain a physician's order for restraints after a thorough patient assessment and exploration of less restrictive interventions. Explanation. Scenario analysis. This scenario is professionally challenging because it involves balancing patient safety with the patient's right to freedom of movement and dignity. The use of restraints, even for safety, carries significant risks, including physical injury, psychological distress, and potential legal and ethical violations if not implemented correctly. Careful judgment is required to determine if restraints are truly necessary and if less restrictive measures have been exhausted. Correct approach analysis. The correct approach prioritizes a comprehensive assessment and the use of least restrictive interventions. This aligns with best professional practice and regulatory guidelines that emphasize patient rights and safety. The National League for Nursing (NLN) pre-admission examination, in its focus on foundational nursing principles, would expect a candidate to understand that restraints are a last resort. This approach involves evaluating the patient's condition, identifying the underlying cause of the unsafe behavior, and exploring alternatives like increased supervision, environmental modifications, or therapeutic communication. When restraints are deemed absolutely necessary, their use must be justified by a physician's order, limited in duration, and accompanied by frequent monitoring and reassessment, all documented meticulously. This adheres to ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as legal requirements regarding patient rights. Incorrect approaches analysis. Implementing restraints without a physician's order is a direct violation of legal and regulatory requirements. It bypasses the necessary medical evaluation to determine the appropriateness and type of restraint, potentially leading to inappropriate application and harm. This constitutes a failure in professional accountability and patient advocacy. Applying restraints based solely on a family member's request, without independent clinical assessment and physician order, disregards the nurse's professional judgment and the established protocols for restraint use. While family input is valuable, the ultimate decision rests on clinical necessity and adherence to regulations designed to protect the patient. This approach fails to uphold the nurse's primary responsibility to the patient's well-being and safety according to established standards. Using restraints as a punitive measure, or for the convenience of staff, is a severe ethical and regulatory breach. Restraints are intended solely for patient safety when all other interventions have failed. Their misuse can lead to patient abuse, neglect, and significant legal repercussions. This demonstrates a profound lack of understanding of patient rights and professional ethical obligations. Professional reasoning. Professionals should employ a systematic decision-making process when considering restraints. This involves 1. Assessment. Thoroughly evaluate the patient's behavior, environment, and underlying causes. 2. Intervention. Explore and implement all less restrictive alternatives. 3. Justification. If restraints are deemed necessary, ensure a physician's order is obtained, specifying the type, duration, and reason. 4. Implementation. Apply restraints correctly and safely, ensuring they do not cause harm. 5. Monitoring. Continuously assess the patient's response, physical and psychological status, and the continued need for restraints. 6. Documentation. Meticulously record all assessments, interventions, orders, and monitoring. 7. Reassessment. Regularly reevaluate the need for restraints and discontinue them as soon as possible. Question 5. The control framework reveals that a registered nurse is preparing to perform a routine vital signs assessment on an elderly patient who is experiencing mild discomfort. The patient expresses a desire to rest for a few more minutes before the assessment. The nurse needs to decide how to proceed. Option A. Politely inform the patient that the vital signs are due and gently assist them into a more comfortable position for the assessment, explaining the importance of timely monitoring. Option B. Explain to the patient that vital signs are a priority and that they must comply with the request for the assessment now. Option C. Proceed with taking the vital signs immediately as scheduled to ensure adherence to the care plan and avoid delays. Option D. Ask the patient if they would prefer to have their vital signs taken later in the shift without offering an alternative immediate solution. The correct answer is A. Politely inform the patient that the vital signs are due and gently assist them into a more comfortable position for the assessment, explaining the importance of timely monitoring. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance patient safety, dignity, and the need for accurate assessment with the practical limitations of a busy healthcare environment. The nurse must make a rapid, informed decision about how to proceed with a fundamental nursing skill while ensuring the patient's well-being and adhering to professional standards. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and dignity. It involves a direct, respectful communication with the patient to understand their needs and preferences, followed by a clear explanation of the procedure. This aligns with the ethical principles of autonomy, respecting the patient's right to make decisions about their care, and beneficence, acting in the patient's best interest. It also adheres to nursing practice standards that emphasize patient-centered care and effective communication. Incorrect approaches analysis. One incorrect approach fails to involve the patient in the decision-making process, potentially leading to a feeling of being disrespected or unheard, which violates the principle of autonomy. It also bypasses an opportunity to understand any underlying reasons for the patient's reluctance, which could be crucial for providing appropriate care. Another incorrect approach prioritizes expediency over patient comfort and dignity. While efficiency is important in healthcare, it should never come at the expense of a patient's well-being or their right to be treated with respect. This approach could lead to patient distress and damage the nurse-patient relationship, undermining trust. A third incorrect approach demonstrates a lack of critical thinking and problem-solving. Simply ignoring the patient's expressed discomfort or preference without attempting to address it is a failure to provide individualized care and can lead to negative patient outcomes. It suggests a rigid adherence to protocol without considering the human element of nursing. Professional reasoning. Professionals should employ a decision-making framework that begins with assessing the situation, identifying patient needs and preferences, considering available resources and protocols, and then implementing the most appropriate and ethical course of action. This involves clear communication, critical thinking, and a commitment to patient-centered care, always prioritizing safety and dignity. Question 6. During the evaluation of a patient newly diagnosed with essential hypertension, which of the following approaches demonstrates the most comprehensive understanding of pharmacotherapeutic principles for initiating treatment? Option A. Reviewing the patient's current medication list for potential drug interactions and considering the patient's comorbidities and specific indications for different antihypertensive classes before selecting a medication. Option B. Recommending a thiazide diuretic as the first-line treatment without considering the patient's electrolyte balance or renal function. Option C. Prescribing a beta blocker without assessing the patient's heart rate or history of respiratory conditions. Option D. Selecting an antihypertensive medication based solely on its common availability and low cost. The correct answer is D. Selecting an antihypertensive medication based solely on its common availability and low cost. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the healthcare professional to synthesize information about a patient's current condition, potential drug interactions, and the specific therapeutic goals for managing hypertension. The risk of adverse drug events or suboptimal treatment necessitates careful consideration of all available data. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and optimal therapeutic outcomes by considering the patient's individual needs and potential drug interactions. This aligns with the fundamental ethical and professional responsibility to provide competent and individualized care, as implicitly guided by professional nursing standards and the expectation of evidence-based practice, which are foundational to the National League for Nursing Pre-Admission Examination scope. Incorrect approaches analysis. One incorrect approach fails to consider the patient's current medication regimen, potentially leading to dangerous drug-drug interactions or additive effects that could cause hypotension or other adverse events. This demonstrates a failure to adhere to the principle of patient safety and competent medication management. Another incorrect approach overlooks the specific indications for each antihypertensive class, potentially leading to the selection of a drug that is not the most appropriate for the patient's specific type of hypertension or comorbidities, thus compromising therapeutic efficacy and patient well-being. This reflects a lack of understanding of pharmacotherapeutics and a deviation from evidence-based practice. A third incorrect approach neglects to consider the patient's potential contraindications or allergies to specific drug classes. This oversight poses a direct risk of severe adverse reactions, violating the core ethical imperative to do no harm and demonstrating a lack of thorough patient assessment. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a comprehensive patient assessment, including a thorough medication history, allergies, and current health status. This is followed by identifying the specific therapeutic goals for the patient's condition. Next, they should evaluate available treatment options, considering the pharmacodynamics and pharmacokinetics of different drug classes, potential drug interaction, contraindications, and patient-specific factors. Finally, they should select the most appropriate treatment, monitor the patient's response, and be prepared to adjust the plan as needed. This iterative process ensures patient safety and optimizes therapeutic outcomes. Question 7. Risk assessment procedures indicate that a patient with a surgical wound on their leg has requested a warm bath for comfort. The nurse is aware that the wound requires specific dressing and monitoring. Which of the following actions best addresses the patient's request while ensuring safety and adherence to best practices? Option A. Deny the request for a bath, explaining that bathing is contraindicated due to the presence of the surgical wound. Option B. Assess the wound's condition. Consult with the healthcare provider regarding any modifications to wound care during bathing, and ensure the bath water temperature is safe and the wound is protected with a clean dressing before and after the bath. Option C. Proceed with the warm bath as requested, as patient comfort is the highest priority and the wound is covered by a dressing. Option D. Delegate the task of bathing to an unlicensed assistive personnel without specific instructions on wound precautions, assuming they will manage it appropriately. Correct answer is B. Assess the wound's condition, consult with the healthcare provider regarding any modifications to wound care during bathing, and ensure the bath water temperature is safe and the wound is protected with a clean dressing before and after the bath. Explanation. Scenario analysis. This scenario presents a common but critical challenge in patient care, balancing a patient's immediate comfort needs with the potential for infection transmission and the need for a safe, therapeutic environment. The patient's desire for a specific comfort measure, a warm bath, conflicts with the nurse's responsibility to maintain sterile or clean environments, especially when the patient has a wound. This requires careful judgment to prioritize safety without compromising patient dignity and comfort. Correct approach analysis. The correct approach prioritizes patient safety and infection control, which are fundamental tenets of nursing practice and are implicitly guided by standards of care and regulatory frameworks that emphasize preventing harm. By assessing the wound, consulting with the healthcare provider, and implementing appropriate precautions, like a clean dressing and monitoring the water temperature, the nurse upholds the principle of do no harm, while still working towards meeting the patient's comfort needs. This aligns with the National League for Nursing's emphasis on safe and effective care delivery, which includes understanding and applying principles of infection control and patient well-being. Incorrect approaches analysis. One incorrect approach involves proceeding with the bath without any assessment or modification. This fails to acknowledge the potential risks associated with immersing a wound in water, which could lead to infection or delayed healing. This directly violates the nursing responsibility to assess and monitor patient conditions and to implement interventions that prevent complications. It also disregards the healthcare provider's orders regarding wound care. Another incorrect approach is to outright refuse the patient's request without exploring alternatives or explaining the rationale. This can lead to patient dissatisfaction, a breakdown in the nurse-patient relationship, and a failure to address the patient's psychosocial needs for comfort and autonomy. While safety is paramount, a compassionate and patient-centered approach involves communication and problem-solving. This approach neglects the holistic aspect of patient care. A third incorrect approach might involve delegating the task to an unlicensed assistive personnel without providing clear instructions on the specific precautions needed for a patient with a wound. This is a failure of supervision and delegation, which can lead to unsafe practices and potential harm to the patient. The nurse remains ultimately responsible for the patient's care, even when tasks are delegated. Professional reasoning. When faced with a conflict between patient comfort and safety, the professional decision-making process involves a systematic approach. 1. Assess the situation thoroughly, identifying all relevant factors: patient condition, wound status, provider orders, patient preferences. 2. Prioritize safety and infection control based on established nursing principles and regulatory guidelines. 3. Communicate with the patient to understand their needs and explain the rationale behind any necessary modifications or limitations. 4. Collaborate with the healthcare team, e.g., physician, to obtain guidance or orders as needed. 5. Implement interventions that balance safety with patient comfort and dignity. 6. Document all assessments, interventions, and communications accurately. Question 8. The risk matrix shows a patient with newly diagnosed diabetes experiencing challenges with blood glucose monitoring and insulin administration. The nurse is considering how to best apply Orum's self-care theory. Which of the following nursing actions best reflects the application of Orum's theory in this situation? Option A. The nurse assumes responsibility for all blood glucose monitoring and insulin administration, as the patient is new to the diagnosis and may be overwhelmed. Option B. The nurse provides direct instruction on blood glucose monitoring techniques and insulin injection procedures, then observes the patient performing these tasks, offering corrective feedback and encouragement to foster independent performance. Option C. The nurse delegates the teaching of blood glucose monitoring and insulin administration to a family member, assuming they will manage the patient's care. Option D. The nurse provides a written pamphlet on diabetes management and instructs the patient to read it at their convenience, assuming they will learn independently. The correct answer is B. The nurse provides direct instruction on blood glucose monitoring techniques and insulin injection procedures, then observes the patient performing these tasks, offering corrective feedback and encouragement to foster independent performance. Explanation. The scenario presents a challenge in applying Orum's self-care theory to a patient with complex needs, requiring a nuanced understanding of the nurse's role in supporting self-care agency. The difficulty lies in balancing the patient's desire for independence with their actual capabilities, necessitating a careful assessment of deficits and the development of appropriate interventions. The correct approach, focusing on identifying specific self-care deficits and collaboratively developing a plan to address them, aligns with Orum's theory by emphasizing the patient agency and the nurse's role as a facilitator. This approach respects the patient's right to self-determination while ensuring their health needs are met. It is ethically sound, promoting patient autonomy and dignity, and is consistent with professional nursing standards that advocate for individualized, patient-centered care. An incorrect approach that solely focuses on the nurse performing all care tasks without assessing the patient's potential for self-care fails to uphold Orum's core principles. This neglects the patient's self-care agency and can lead to learned helplessness, undermining their ability to participate in their own care. Ethically, this approach can be seen as paternalistic and disrespectful of the patient's autonomy. Another incorrect approach that assumes the patient is incapable of any self-care without a thorough assessment is also problematic. This overlooks potential strengths and underestimates the patient's capacity to learn or adapt. It represents a failure to conduct a comprehensive nursing assessment, a fundamental ethical and professional requirement. The professional decision-making process in such situations involves a systematic assessment of the patient's self-care abilities and limitations, a collaborative discussion about their goals and preferences, and the co-creation of a care plan that empowers them to participate in their care to the greatest extent possible. This process prioritizes patient-centeredness, respects autonomy, and adheres to the principles of therapeutic nursing intervention as outlined by Orum. Question 9. Regulatory review indicates that a registered nurse observes a physician preparing to administer a medication to a patient without verifying the patient's identity using two patient identifiers. The nurse is concerned this action could lead to a medication error and compromise patient safety. What is the most appropriate immediate action for the nurse to take? Option A. Document the observation in the patient's chart and wait for the next scheduled handover report to discuss it with the oncoming nurse. Option B. Immediately report the physician's actions to the hospital's risk management department without speaking to the physician first. Option C. Inform the charge nurse of the observation and ask them to address the physician directly. Option D. Politely and directly address the physician, stating the concern and reminding them of the need for two patient identifiers before medication administration. The correct answer is D. Politely and directly address the physician, stating the concern and reminding them of the need for two patient identifiers before medication administration. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare where a nurse observes a potential deviation from standard practice that could compromise patient safety. The professional challenge lies in balancing the need for immediate intervention to protect the patient with the established protocols for reporting and addressing concerns, while also respecting the roles and responsibilities of other healthcare professionals. Careful judgment is required to determine the most effective and appropriate course of action that upholds patient well-being and adheres to professional standards. Correct approach analysis. The correct approach prioritizes immediate patient safety by directly addressing the observed issue with the responsible healthcare provider. This aligns with the fundamental ethical and professional obligation of nurses to advocate for their patients and intervene when a patient is at risk. The National League for Nursing, NLN, emphasizes the nurse's role in identifying and mitigating risks to patient safety. By speaking directly to the physician, the nurse initiates a collaborative problem-solving process, allowing for clarification, correction, and prevention of potential harm in real time, which is the most efficient way to ensure patient safety in this immediate situation. Incorrect approaches analysis. One incorrect approach involves waiting for a scheduled handover report. This delays intervention, leaving the patient vulnerable to potential harm during the interim. This failure to act promptly violates the nurse's duty of care and the core principle of patient safety, which mandates immediate action when a risk is identified. It also overlooks the urgency of the situation, potentially exacerbating the negative impact on the patient. Another incorrect approach is to document the observation without immediate action or communication. While documentation is crucial, it should follow, not replace, timely intervention. This approach fails to address the immediate risk to the patient, thereby compromising their safety. It also represents a passive stance when active intervention is required by professional nursing standards. A third incorrect approach is to bypass the physician and immediately report to a supervisor. While escalation is sometimes necessary, it is generally not the first step when a direct and immediate resolution is possible. This approach can undermine collegial relationships and may not be the most efficient way to resolve the immediate safety concern, potentially delaying the necessary correction. It also fails to utilize the established chain of communication for addressing clinical issues directly with the responsible party. Professional reasoning. Professionals should employ a systematic approach to patient safety concerns. This involves 1. Recognizing and assessing the potential risk to the patient. 2. Determining the immediacy and severity of the risk. 3. Considering the most direct and effective means of intervention. 4. Communicating clearly and respectfully with the responsible party. 5. Documenting the event and the actions taken. 6. Escalating the concern if the initial intervention is unsuccessful or if the situation warrants it. This framework ensures that patient safety remains the paramount concern, while maintaining professional conduct and adhering to established protocols. Question 10. The audit findings indicate that a patient admitted for a chronic illness exacerbation is exhibiting significant anxiety and withdrawal, impacting their engagement with the prescribed self-management regimen. Applying Roy's adaptation model, which of the following nursing approaches would best facilitate the patient's adaptation? Option A. Focus solely on educating the patient about the physiological aspects of their illness. Option B. Administer prescribed anxiolytic medication to reduce the patient's immediate distress. Option C. Provide the patient with a detailed pamphlet outlining the chronic illness and its management. Option D. Develop a collaborative plan with the patient to identify specific stressors contributing to their anxiety and explore alternative coping strategies that align with their personal values and beliefs. The correct answer is D. Develop a collaborative plan with the patient to identify specific stressors contributing to their anxiety and explore alternative coping strategies that align with their personal values and beliefs. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the nurse to interpret and apply a theoretical nursing model, Roy's adaptation model, to a complex patient situation identified through an audit. The challenge lies in moving beyond superficial observations to a deeper understanding of the patient's adaptive responses and identifying areas where support is needed, all while adhering to professional nursing standards and potentially institutional policies. Careful judgment is required to select the most appropriate nursing intervention based on the model's principles. Correct approach analysis. The correct approach aligns with Roy's adaptation model by focusing on identifying the patient's stimuli, both internal and external, and assessing their current adaptive behaviors. It then aims to determine if these behaviors are effective in meeting the demands of the situation. By proposing an intervention that directly addresses the identified ineffective coping mechanisms and aims to enhance the patient's ability to adapt, this approach exemplifies best professional practice. This is ethically justified by the nursing's commitment to patient well-being and promoting self-care, and professionally supported by the principles of evidence-based practice and the application of nursing theory to guide care. Incorrect approaches analysis. One incorrect approach might involve simply documenting the patient's current state without further analysis or intervention. This fails to uphold the nursing responsibility to actively promote adaptation and improve patient outcomes, potentially violating ethical obligations to provide comprehensive care. Another incorrect approach could be to implement a generic intervention that is not specifically linked to the patient's identified adaptive deficits or the principles of Roy's model. This lacks the individualized, theory-driven care that is essential for effective nursing practice and could lead to ineffective or even harmful interventions, representing a failure in professional judgment and potentially a breach of the standard of care. A third incorrect approach might be to focus solely on the medical diagnosis without considering the patient's psychosocial and physiological responses as described by Roy's model, thereby neglecting the holistic nature of nursing care and failing to address the patient's adaptive capacity. Professional reasoning. Professionals should approach such situations by first thoroughly understanding the patient's presenting problem within the context of Roy's adaptation model. This involves identifying the focal, contextual, and residual stimuli. Next, they must assess the patient's current behaviors and determine their effectiveness in adapting to these stimuli. Based on this assessment, they should formulate nursing diagnoses that reflect the patient's adaptive status. Finally, they should select and implement nursing interventions that are designed to promote effective adaptation, manage ineffective coping, and enhance the patient's ability to respond to the demands of their environment. This systematic, theory-guided process ensures that care is individualized, effective, and ethically sound. Question 11. Benchmark analysis indicates that a patient recovering from surgery is expressing significant reluctance to participate in physical therapy, stating, "I just don't feel like it, and I'm so alone here." The nurse observes the patient appears withdrawn and avoids eye contact. Considering the holistic needs of the patient, which of the following actions best addresses the patient's overall well-being and promotes engagement in their recovery? Option A. Gently encourage the patient to try a few simple exercises, explaining the importance of physical therapy for their recovery, and then schedule a follow-up to discuss their feelings further. Option B. Immediately inform the patient that physical therapy is mandatory for their recovery and that their feelings are not a primary concern at this time. Option C. Acknowledge the patient's feelings of reluctance and isolation, and inquire further about what is contributing to their feelings before proceeding with the physical therapy session. Option D. Suggest the patient focus on their spiritual beliefs to find strength and encourage them to reach out to family for social support before starting physical therapy. The correct answer is A. Gently encourage the patient to try a few simple exercises, explaining the importance of physical therapy for their recovery, and then schedule a follow-up to discuss their feelings further. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to navigate a patient's multifaceted needs that extend beyond immediate physical symptoms. The patient's reluctance to engage in physical therapy due to social isolation and spiritual distress highlights the interconnectedness of physical, emotional, social, and spiritual dimensions of well-being. A holistic approach is paramount, as neglecting any one dimension can impede recovery and overall health outcomes. Careful judgment is required to ensure interventions are patient-centered and address the root causes of resistance, not just the surface-level physical deficit. Correct approach analysis. The correct approach, which involves exploring the patient's feelings about social isolation and spiritual concerns before proceeding with physical therapy, represents best professional practice. This aligns with the ethical principles of patient autonomy and beneficence, as mandated by nursing practice standards. By acknowledging and addressing the patient's emotional and spiritual state, the nurse demonstrates respect for the patient's dignity and promotes trust. This patient-centered strategy is crucial for effective care planning and adherence to treatment, ultimately supporting the patient's holistic recovery. This approach is consistent with the National League for Nursing's emphasis on comprehensive patient care that considers all aspects of a person's life. Incorrect approach is analysis. One incorrect approach would be to solely focus on the physical therapy regimen without acknowledging the patient's expressed emotional and spiritual distress. This fails to recognize the interconnectedness of the patient's dimensions of well-being and can lead to patient non-compliance and a lack of therapeutic alliance. Ethically, it violates the principle of beneficence by not addressing the patient's full needs and potentially causing further emotional harm. Another incorrect approach would be to dismiss the patient's social isolation and spiritual concerns as irrelevant to physical therapy. This demonstrates a lack of empathy and a failure to understand the patient as a whole person. It disregards the significant impact these factors can have on motivation, engagement, and recovery, leading to ineffective care. A third incorrect approach would be to immediately refer the patient to a spiritual advisor or social worker without first attempting to understand the patient's perspective and feelings directly. While these referrals may be necessary, bypassing the nurse's initial assessment and empathetic engagement can feel impersonal and may not fully capture the patient's immediate needs or concerns. Professional reasoning. Professionals should employ a patient-centered decision-making process that begins with active listening and empathetic inquiry. When faced with patient resistance or concerns, the first step is to explore the underlying reasons, considering all dimensions of the patient's experience. This involves open-ended questions to understand their emotional state, social context, and spiritual beliefs. Based on this understanding, the nurse can then collaboratively develop a care plan that integrates physical interventions with support for emotional, social, and spiritual needs. This may involve modifying the physical therapy approach, providing emotional support, facilitating social connections, or coordinating with other healthcare professionals as appropriate, always prioritizing the patient's autonomy and well-being. Question 12. Implementation of a culturally sensitive approach to gathering a health history from a patient who appears hesitant to disclose personal information due to their cultural background requires careful consideration of communication strategies. Which of the following actions best demonstrates this sensitivity? Option A. Directly ask a series of detailed questions about all potential health concerns, assuming that the patient will volunteer all necessary information if prompted sufficiently. Option B. Gently inquire about family health history using open-ended questions, observing nonverbal cues, and allowing the patient to share information at their own pace, while also asking if there are any specific cultural beliefs about health or illness that are important to them. Option C. Proceed with a standard, comprehensive health history questionnaire, explaining that all information is required for accurate assessment, regardless of the patient's comfort level. Option D. Focus primarily on observable physical signs and symptoms, minimizing verbal questioning about personal history to avoid making the patient uncomfortable. The correct answer is B. Gently inquire about family health history using open-ended questions, observing nonverbal cues, and allowing the patient to share information at their own pace, while also asking if there are any specific cultural beliefs about health or illness that are important to them. Explanation. The scenario presents a common challenge in healthcare. Obtaining a comprehensive health history from a patient whose cultural background may influence their communication style, beliefs about health and illness, and willingness to share personal information. The professional challenge lies in balancing the need for accurate and complete data with the imperative to be culturally sensitive and build trust. Failure to do so can lead to misdiagnosis, ineffective treatment plans, and a breakdown in the patient-provider relationship. The correct approach prioritizes establishing rapport and demonstrating respect for the patient's cultural context. This involves active listening, using open-ended questions, and being observant of nonverbal cues. It acknowledges that direct questioning about sensitive topics may not be appropriate or effective in all cultures, and that building trust may require a more indirect or gradual approach. This aligns with ethical principles of patient-centered care and the professional obligation to provide care that is both effective and respectful of individual differences. While specific regulations for the NLN pre-admission examination are not provided, general nursing ethics and best practices emphasize cultural competence as a cornerstone of quality care. An incorrect approach that focuses solely on obtaining a checklist of information without regard for the patient's cultural comfort or communication preferences risks alienating the patient and obtaining incomplete or inaccurate data. This could be seen as a failure to uphold the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as incomplete information can lead to harm. Another incorrect approach that assumes all patients from a particular cultural group will behave in a uniform manner demonstrates stereotyping, which is a violation of professional ethics and can lead to significant misunderstandings and mistrust. This approach fails to recognize the individuality within cultural groups. A third incorrect approach that dismisses the patient's cultural expressions as irrelevant or unimportant disregards the patient's lived experience and can be perceived as disrespectful, hindering the development of a therapeutic relationship. Professionals should employ a decision-making process that begins with self-awareness of their own cultural biases. They should then actively seek to understand the patient's cultural background and preferences, using open-ended questions and attentive listening. When faced with communication barriers or reluctance to share information, professionals should explore alternative methods of gathering information, such as involving a trusted family member, with patient consent, or utilizing culturally appropriate communication aids, while always prioritizing patient autonomy and confidentiality. The goal is to create a safe and trusting environment where the patient feels comfortable sharing the information necessary for optimal care. Question 13. The assessment process reveals a 3-year-old child who is not yet consistently using 2-word phrases and primarily communicates through gestures and single words, while peers in their age group are typically engaging in simple sentence construction. The child also demonstrates difficulty with imaginative play, preferring to stack blocks repetitively rather than engaging in pretend scenarios. What is the most appropriate next step for the healthcare professional? Option A. Recommend further developmental screening using age-appropriate tools and discuss observations with the parents to gather more information about the child's communication and play patterns at home. Option B. Immediately refer the child for a formal diagnosis of a speech and language disorder and a developmental disability. Option C. Focus solely on the child's motor skills, as language development is less critical at this age. Option D. Advise the parents that this is a normal variation, and the child will likely catch up to their peers without any intervention. The correct answer is A. Recommend further developmental screening using age-appropriate tools and discuss observations with the parents to gather more information about the child's communication and play patterns at home. Explanation. The assessment process reveals a child exhibiting behaviors that deviate from typical growth and development milestones. This scenario is professionally challenging because it requires the healthcare professional to accurately identify potential developmental delays or deviations, while also considering the child's individual context and avoiding premature or inaccurate labeling. The professional must balance the need for early intervention with the risk of over-medicalization or causing undue parental anxiety. Careful judgment is required to differentiate between normal variations in development and genuine concerns that warrant further investigation or intervention. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment. This aligns with the ethical and regulatory imperative to provide patient-centered care, which includes understanding the child's unique developmental trajectory within their environmental and familial context. By consulting established developmental screening tools and collaborating with parents, the professional ensures that the assessment is thorough and considers multiple perspectives. This approach respects the child's individuality and the parent's role as primary caregivers, fostering trust and facilitating effective communication regarding any concerns. Regulatory frameworks for healthcare professionals emphasize the importance of evidence-based practice and thorough assessment before making any diagnostic or treatment recommendations. An incorrect approach that relies solely on anecdotal observations without utilizing standardized tools fails to meet the professional standard for developmental assessment. This could lead to misinterpretations of the child's behavior, potentially causing unnecessary worry for parents or overlooking significant developmental issues. Ethically, it breaches the duty of care by not employing the most effective and reliable methods available. Another incorrect approach that immediately labels the child with a specific developmental disorder based on limited observation is professionally unacceptable. This premature diagnosis can have profound negative impacts on the child and family, potentially leading to stigmatization and inappropriate interventions. It violates the principle of do no harm and disregards the complexity of child development, which often involves a period of observation and differential diagnosis. Regulatory guidelines mandate that diagnoses be made based on comprehensive evaluations and established diagnostic criteria, not on isolated incidents. The professional reasoning process for similar situations should involve a systematic approach. First, gather information through observation and parent-teacher reports. Second, utilize validated developmental screening tools to objectively assess various domains of development. Third, consider the child's medical history, environmental factors, and cultural background. Fourth, collaborate with parents to understand their concerns and observations. And fifth, if concerns persist, refer to appropriate specialists for further evaluation. This structured decision-making process ensures that assessments are accurate, ethical, and in the best interest of the child. Question 14. Quality control measures reveal a nursing student consistently struggles to incorporate a patient's deeply held cultural beliefs regarding diet into their care plan, often defaulting to standard dietary recommendations without further exploration. Which of the following approaches best demonstrates the student's development of cultural competence in this situation? Option A. The student explains to the patient that standard dietary recommendations are based on scientific evidence and are crucial for their recovery, implying the patient's beliefs are less important. Option B. The student proceeds with the prescribed diet, documenting that the patient was informed of the standard recommendations, without further engagement on the cultural aspects. Option C. The student expresses concern that the patient's cultural beliefs might hinder their recovery, and suggests the patient reconsider their adherence to these beliefs for the sake of their health. Option D. The student actively listens to the patient's dietary beliefs, asks clarifying questions about their cultural significance, and collaborates with the patient and a dietitian to identify culturally appropriate meal modifications that align with medical needs. Correct answer is D. The student actively listens to the patient's dietary beliefs, asks clarifying questions about their cultural significance, and collaborates with the patient and a dietitian to identify culturally appropriate meal modifications that align with medical needs. Explanation. Scenario analysis. This scenario presents a common challenge in nursing where a patient's cultural beliefs may conflict with standard medical recommendations. The professional challenge lies in balancing the nurse's duty to provide evidence-based care with the patient's right to self-determination and cultural respect. Failure to navigate this requires careful judgment to avoid alienating the patient, compromising their trust, or inadvertently causing harm through a lack of understanding. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing open communication, active listening, and a collaborative approach to care planning. This aligns with the ethical principles of beneficence, acting in the patient's best interest, which includes respecting their values and autonomy, respecting the patient's right to make decisions about their own care. Furthermore, it reflects the National League for Nursing's emphasis on patient-centered care and the understanding that cultural competence is integral to providing safe and effective nursing care. By seeking to understand the underlying reasons for the patient's beliefs and exploring alternative, culturally sensitive interventions, the nurse upholds the dignity of the patient and fosters a therapeutic relationship. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's beliefs as irrational or uninformed. This is a failure of cultural competence and violates the ethical principle of respect for persons. It can lead to patient noncompliance, mistrust, and a breakdown in the nurse-patient relationship, potentially compromising the patient's health outcomes. This approach also fails to acknowledge the diverse backgrounds of patients and the impact of culture on health beliefs and practices, which is a core tenet of professional nursing. Another incorrect approach is to proceed with the standard treatment plan without addressing the patient's concerns or attempting to integrate their cultural beliefs. This demonstrates a lack of cultural sensitivity and can be perceived as disrespectful by the patient. It ignores the patient's autonomy and can lead to feelings of disempowerment. Ethically, it falls short of providing truly patient-centered care, which requires understanding and responding to the individual's unique needs and values. A third incorrect approach is to impose the nurse's own beliefs or values onto the patient. This is a clear violation of professional boundaries and ethical principles. It demonstrates a lack of cultural humility and can be deeply offensive to the patient, damaging the therapeutic relationship and potentially leading to adverse health outcomes due to a lack of trust and cooperation. Professional reasoning. Professionals should approach such situations by first recognizing the potential for cultural differences to influence health beliefs and practices. Decision-making process should involve active listening to understand the patient's perspective, asking open-ended questions to explore their beliefs and concerns, and then collaboratively developing a care plan that respects both the patient's cultural values and the best available evidence for safe and effective care. This involves seeking to understand, not to judge, and finding common ground where possible, or respectfully acknowledging differences while ensuring patient safety. Question 15. The performance metrics show a slight increase in patient satisfaction scores related to communication, but a concerning trend in delayed symptom reporting for patients with family present during initial assessments. A nurse is admitting a patient who appears uncomfortable when their family begins to ask questions about their symptoms. What is the most appropriate initial communication strategy? Option A. Focus solely on gathering information from the family, assuming the patient is unable to articulate their needs. Option B. Politely ask the family if the patient would prefer to speak with the nurse privately about their health concerns. Option C. Proceed with asking the patient direct questions about their symptoms in front of the family to ensure all information is gathered quickly. Option D. Inform the family that all communication must go through the patient and refuse to answer any of their questions. The correct answer is B. Politely ask the family if the patient would prefer to speak with the nurse privately about their health concerns. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the immediate need for information with the patient's right to privacy and dignity. The nurse must assess the situation quickly and decide on the most appropriate communication strategy that respects the patient's autonomy while ensuring their safety and well-being. The presence of family members adds a layer of complexity, as their involvement needs to be managed carefully. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient-centered communication and respecting patient autonomy. The nurse's action of seeking to speak with the patient privately aligns with ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make decisions about their care and information. This approach also adheres to the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., which mandates the protection of patient health information and requires healthcare providers to take reasonable steps to ensure privacy. By seeking a private conversation, the nurse creates a safe space for the patient to share sensitive information without feeling pressured or embarrassed by the presence of family. This fosters trust and encourages open communication, which is crucial for accurate assessment and effective care planning. Incorrect approach is analysis. One incorrect approach would be to immediately ask the patient about their symptoms in front of the family. This violates the patient's right to privacy and could lead to them withholding important information due to embarrassment or fear of judgment from their family. It fails to uphold the principle of autonomy and could breach HIPAA regulations regarding the disclosure of protected health information without patient consent. Another incorrect approach would be to ignore the patient's discomfort and proceed with questioning the family about the patient's condition. This disregards the patient's presence and their right to be the primary source of information about their own health. It is paternalistic and undermines the therapeutic relationship, potentially leading to mistrust and noncompliance. Ethically, it fails to respect the patient as an individual and could be seen as a violation of their dignity. A third incorrect approach would be to dismiss the family's concerns entirely and refuse to speak with them at all, even if they express genuine worry or have relevant information. While patient privacy is paramount, a complete dismissal of family involvement can be detrimental to patient care, especially if the patient is unable to fully communicate their needs or if the family plays a significant role in their support system. A balanced approach is necessary, and a complete refusal to engage can be seen as a failure in communication and collaboration, potentially impacting the continuity of care and patient support. Professional reasoning. Professionals should employ a decision-making framework that begins with assessing the immediate situation and identifying potential ethical or regulatory conflicts. In this case, the conflict is between the need for information and patient privacy. The nurse should then consider the principles of patient-centered care, autonomy, beneficence, and non-maleficence. The next step involves evaluating communication strategies that uphold these principles. Seeking a private conversation is a direct application of respecting patient autonomy and privacy, which are foundational to ethical nursing practice and regulatory compliance. If the patient is unable to communicate, the nurse would then explore appropriate avenues for obtaining information, always prioritizing the patient's best interests and legal mandates. Question 16. Investigation of a patient's reluctance to disclose a history of substance abuse during a pre-admission health assessment, despite the information being crucial for their upcoming surgical procedure, presents an ethical challenge. The patient expresses fear of judgment and potential denial of care. What is the most appropriate initial approach for the healthcare professional? Option A. Inform the patient that this information is mandatory for admission and that failure to disclose will result in the cancellation of their surgery. Option B. Immediately contact the patient's listed emergency contact to discuss the situation and gather the necessary history. Option C. Gently explain the importance of this information for safe surgical planning and pain management. Reassure the patient about strict confidentiality and offer to discuss it in a private setting. Option D. Proceed with the assessment without this specific information, assuming it is not critical for the immediate preoperative evaluation. The correct answer is C. Gently explain the importance of this information for safe surgical planning and pain management. Reassure the patient about strict confidentiality and offer to discuss it in a private setting. Explanation. This scenario presents a professional challenge due to the conflict between a patient's right to privacy and the healthcare provider's ethical and professional obligation to obtain a complete and accurate health history for effective care. The patient's reluctance to disclose sensitive information, even if it impacts their health, creates an ethical dilemma. Careful judgment is required to balance patient autonomy with the imperative of providing safe and competent care. The correct approach represents best professional practice because it prioritizes patient trust and autonomy while still advocating for the patient's well-being. By explaining the importance of the information and offering reassurance about confidentiality, the healthcare provider attempts to build rapport and encourage disclosure without coercion. This aligns with ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, honoring the patient's right to make decisions about their health information. It also adheres to professional guidelines that emphasize open communication and patient-centered care. An incorrect approach that involves dismissing the patient's concerns or proceeding with care without a complete history would be a regulatory and ethical failure. Dismissing concerns violates the principle of respect for persons and can erode patient trust, making future disclosure even less likely. Proceeding without a complete history compromises the provider's ability to accurately assess the patient's condition and develop an appropriate care plan, potentially leading to harm, which violates the principle of non-maleficence, do no harm. Furthermore, it could be seen as a failure to meet professional standards of care. Another incorrect approach, such as immediately involving family members without the patient's explicit consent, would be a significant breach of patient confidentiality and privacy regulations. This violates the patient's right to control their personal health information and could lead to legal repercussions and irreparable damage to the patient-provider relationship. The professional decision-making process for similar situations involves several steps. First, actively listen to and acknowledge the patient's concerns. Second, clearly and empathetically explain why the requested information is important for their care. Third, reassure the patient about confidentiality and the measures in place to protect their privacy. Fourth, explore alternative ways to obtain the necessary information if direct disclosure remains difficult, always with the patient's consent. Finally, document the conversation and the patient's decision, and reassess the need for the information as care progresses. Question 17. What factors determine the most appropriate sequence and technique for performing a physical examination on an anxious patient experiencing mild discomfort? Option A. The patient's previous medical history and the standard examination checklist provided by the institution. Option B. The time constraints of the shift and the perceived urgency of completing the entire examination protocol. Option C. The nurse's personal preference for examination order and the availability of examination equipment. Option D. The patient's level of anxiety and discomfort, the specific body system being assessed, and the need for patient cooperation. The correct answer is D. The patient's level of anxiety and discomfort, the specific body system being assessed, and the need for patient cooperation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the need for a thorough physical examination with the patient's immediate comfort and dignity. The patient's anxiety and potential for pain during the examination necessitate a sensitive and adaptable approach. A rigid adherence to a standard examination protocol without considering the patient's state could lead to distress, non-cooperation, and potentially inaccurate findings. The nurse must exercise clinical judgment to modify the examination to be as minimally invasive and comfortable as possible while still gathering essential data. Correct approach analysis. The correct approach prioritizes patient comfort and cooperation by adapting the physical examination techniques to the patient's current emotional and physical state. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it reflects the nursing standard of care which mandates individualized patient assessment. By explaining each step, allowing the patient to control the pace, and using less intrusive methods when possible, the nurse builds trust and facilitates a more accurate and complete assessment. This approach respects patient autonomy and promotes a positive patient-provider relationship, which is crucial for effective healthcare delivery. Incorrect approaches analysis. One incorrect approach involves proceeding with a standard, systematic examination without acknowledging or addressing the patient's anxiety and discomfort. This fails to uphold the ethical duty of care by potentially causing unnecessary distress and violating the principle of non-maleficence. It also disregards the patient's autonomy by not involving them in the decision-making process regarding their own examination. Another incorrect approach is to postpone the examination indefinitely due to the patient's anxiety. While empathy is important, delaying a necessary physical assessment can lead to misdiagnosis or delayed treatment, which is contrary to the principle of beneficence and can constitute professional negligence if it results in patient harm. The nurse has a responsibility to perform the assessment in a manner that is as comfortable as possible, not to avoid it entirely. A third incorrect approach is to rush through the examination to minimize patient discomfort, potentially skipping crucial steps or failing to observe subtle findings. This compromises the thoroughness of the assessment, directly impacting the quality of care and potentially leading to incomplete or inaccurate diagnoses, which violates the standard of care and the principle of beneficence. Professional reasoning. Professionals should employ a patient-centered approach to physical examinations. This involves 1. Initial assessment of the patient's emotional and physical state. 2. Clear and concise communication, explaining the purpose and steps of the examination. 3. Active listening to the patient's concerns and feedback. 4. Gradual introduction of examination techniques, starting with less invasive methods. 5. Flexibility to modify the examination based on patient tolerance and response. 6. Continuous reassessment of patient comfort throughout the process. This systematic yet adaptable approach ensures both the efficacy of the examination and the well-being of the patient. Question 18. When evaluating a patient presenting with symptoms suggestive of an infectious process, which of the following actions demonstrates the most appropriate initial response to ensure infection control? Option A. Immediately begin patient assessment and intervention, prioritizing speed to address the patient's discomfort and address hygiene protocols after the initial stabilization. Option B. Utilize the same gloves for initial assessment and subsequent procedures to conserve time and resources. Option C. Perform thorough hand hygiene and don appropriate personal protective equipment, PPE, based on the suspected transmission route before initiating direct patient contact. Option D. Rely on the patient's self-reported hygiene practices to determine the necessity of personal protective equipment. The correct answer is A. Immediately begin patient assessment and intervention, prioritizing speed to address the patient's discomfort and address hygiene protocols after the initial stabilization. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the healthcare professional to balance immediate patient needs with established infection control protocols. The pressure to provide care quickly can sometimes lead to shortcuts, which can have severe consequences for patient safety and public health. Adherence to infection control is paramount in preventing healthcare-associated infections, which are a significant concern in healthcare settings and are regulated by bodies like the Centers for Disease Control and Prevention, CDC, and the Occupational Safety and Health Administration, OSHA, in the U.S. Correct approach analysis. The correct approach involves a systematic assessment of the situation, prioritizing patient safety and adherence to established infection control guidelines. This includes proper hand hygiene, use of personal protective equipment, PPE, as indicated by the risk assessment, and appropriate environmental cleaning and disinfection. Following these established protocols, as outlined by the NLN and regulatory bodies, is essential to prevent the transmission of pathogens, protect both the patient and the healthcare provider, and maintain a safe healthcare environment. This aligns with the core ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approaches analysis. One incorrect approach would be to proceed with patient care without performing hand hygiene or donning appropriate PPE, assuming the risk is low or due to time constraints. This directly violates CDC guidelines and OSHA standards for infection control and PPE use, increasing the risk of pathogen transmission and potential HAIs. Ethically, this demonstrates a failure to uphold the duty of care and a disregard for patient safety. Another incorrect approach would be to use the same gloves for multiple patient interactions or for different tasks on the same patient without changing them. This is a critical breach of standard precautions, as it facilitates the direct transfer of microorganisms between patients or from a contaminated source to a clean one. This practice is explicitly prohibited by infection control guidelines and poses a significant risk of cross-contamination and infection. A third incorrect approach would be to neglect proper cleaning and disinfection of equipment or the patient's environment after use. This allows pathogens to persist, creating a reservoir for future transmission. Regulatory bodies mandate thorough cleaning and disinfection protocols to minimize environmental contamination, and failure to adhere to these standards directly compromises patient safety and can lead to outbreaks. Professional reasoning. When faced with a situation requiring immediate patient care, a healthcare professional should employ a decision-making process that integrates critical thinking with established protocols. This involves 1. rapidly assessing the immediate risks to the patient and oneself, considering potential infectious agents and modes of transmission. 2. Recalling and applying relevant infection control principles and guidelines, e.g., standard precautions, transmission-based precautions. 3. Selecting and correctly using appropriate PPE based on the risk assessment. 4. Performing meticulous hand hygiene before and after patient contact and any procedures. 5. Ensuring proper cleaning and disinfection of equipment and the environment. If time is a critical factor, the professional must still integrate these essential steps, perhaps by performing hand hygiene while preparing other necessary supplies, rather than omitting them. Question 19. Operational review demonstrates that a patient, visibly distressed and tearful, is hesitant to discuss the reason for their visit. The nurse needs to encourage the patient to share their concerns to provide appropriate care. Which therapeutic communication technique would be most effective in this situation? Option A. Offering immediate solutions and advice to alleviate the patient's distress. Option B. Frequently interrupting the patient to ask direct, probing questions. Option C. Changing the subject to a less sensitive topic to ease the tension. Option D. Reflecting the patient's feelings and summarizing their statements to encourage further elaboration. The correct answer is D. Reflecting the patient's feelings and summarizing their statements to encourage further elaboration. Explanation. Scenario analysis. This scenario is professionally challenging because the nurse must balance the patient's immediate emotional distress with the need to gather essential information for care. The patient's anxiety and potential for withdrawal require a sensitive and skilled communication approach to build trust and facilitate disclosure without causing further distress or violating patient privacy. Careful judgment is required to select a technique that is both empathetic and effective in eliciting necessary information. Correct approach analysis. Active listening, which involves paying full attention to the patient, understanding their message, responding thoughtfully, and remembering the information, represents best professional practice. This technique demonstrates respect for the patient's feelings and concerns, creating a safe environment for them to express themselves. By reflecting the patient's feelings and summarizing their statements, the nurse validates their experience and ensures accurate understanding, which is crucial for providing appropriate care. This aligns with ethical principles of beneficence and non-maleficence, ensuring the patient's well-being and avoiding harm. Incorrect approach is analysis. Offering unsolicited advice can be perceived as dismissive of the patient's feelings and may shut down communication. It can imply that the nurse believes they know better than the patient what is needed, violating the principle of patient autonomy and potentially leading to a breakdown in trust. This approach fails to acknowledge the patient's emotional state and can be seen as a breach of professional empathy. Interrupting the patient frequently, even with good intentions, can make the patient feel unheard and disrespected. This can escalate their anxiety and lead them to withhold important information, directly contradicting the goal of therapeutic communication. It violates the ethical principle of respecting the patient's dignity and right to express themselves fully. Changing the subject abruptly, without acknowledging the patient's current concerns, can make the patient feel unimportant or that their issues are not being taken seriously. This can damage the therapeutic relationship and prevent the nurse from obtaining a complete picture of the patient's situation, potentially leading to suboptimal care. This demonstrates a lack of professional sensitivity and can be ethically problematic in terms of patient-centered care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient-centered care and ethical principles. This involves assessing the patient's emotional state, identifying communication barriers, and selecting techniques that foster trust and open dialogue. The nurse should continuously evaluate the effectiveness of their communication and adapt their approach as needed, always aiming to understand the patient's perspective and needs. This iterative process ensures that communication remains therapeutic and contributes positively to the patient's care plan. Question 20. The performance metrics show a concerning trend in the accuracy and completeness of health assessments performed by nursing students, impacting patient care outcomes. When a student nurse is conducting a health assessment, which approach best aligns with the principles of comprehensive patient care and professional nursing standards? Option A. Focusing primarily on the chief complaint and gathering only the information directly related to that symptom. Option B. Prioritizing a systematic head-to-toe physical examination, while actively engaging the patient in open-ended questions about their health history, current concerns, and lifestyle. Option C. Quickly reviewing the patient's electronic health record and asking a few targeted questions to confirm existing information. Option D. Relying on the patient's self-report without performing a physical examination to avoid causing discomfort. The correct answer is B. Prioritizing a systematic head-to-toe physical examination while actively engaging the patient in open-ended questions about their health history, current concerns, and lifestyle. Explanation. The performance metrics show a decline in patient satisfaction scores related to the thoroughness of health assessments conducted by nursing students. This scenario is professionally challenging because it directly impacts the quality of patient care and the educational outcomes of the students. Ensuring comprehensive and accurate health assessments is a fundamental nursing responsibility, governed by professional standards and ethical obligations to provide safe and effective care. The pressure to complete assessments quickly, coupled with varying levels of student experience, can lead to superficial data collection. The correct approach represents best professional practice because it prioritizes patient safety and the development of essential nursing skills. A systematic and comprehensive health assessment, encompassing all relevant domains e.g., physical, psychosocial, cultural, is crucial for identifying patient needs, developing appropriate care plans, and preventing adverse events. This aligns with the core principles of nursing practice and the educational objectives of the National League for Nursing, which emphasize the importance of a holistic patient assessment. Adhering to established assessment frameworks and protocols ensures that students are learning to gather all necessary information, fostering critical thinking and clinical judgment. An incorrect approach that focuses solely on completing a checklist without deeper inquiry or patient interaction fails to meet the standards of a competent health assessment. This approach risks overlooking critical signs and symptoms, leading to misdiagnosis or delayed intervention, which is a direct violation of the nurse's duty of care. Another incorrect approach that relies heavily on assumptions based on previous patient encounters or stereotypes, rather than individualized assessment, is ethically unsound and can perpetuate health disparities. This violates the principle of patient-centered care and the ethical obligation to treat each patient with respect and dignity. A third incorrect approach that prioritizes speed over accuracy, leading to rushed interviews and incomplete physical examinations, compromises the integrity of the assessment process and can result in significant omissions of vital health data. This directly contravenes the expectation of thoroughness and diligence in nursing practice. Professionals should employ a decision-making process that begins with understanding the core purpose of the health assessment, to gather comprehensive data for effective patient care. This involves utilizing established assessment frameworks, actively listening to patients, performing thorough physical examinations, and critically analyzing the collected data. When faced with performance metrics indicating deficiencies, the professional response should be to identify the root cause, implement targeted educational interventions, and provide opportunities for supervised practice and feedback to ensure students develop the necessary skills and judgment for safe and effective patient assessment.